This is the BestHealth Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good afternoon, everyone. Welcome to another edition of the BestHealth Podcast. We are facilitating several podcasts here using virtual technology and doing them from remote locations due to the coronavirus COVID-19 situation that has altered most everyone's life here. And we are going to be talking related to COVID-19 and coronavirus again today. What I wanted to do today was facilitate a second conversation with Dr. Linda Nicolotti. Excuse me, Dr. Nicolotti, didn't mean to mess up your name. But Dr. Nicolotti is joining us today, and she did a Best Health Podcast a couple weeks ago with us. And really, when so much has changed in the last 2 weeks with most everyone's lives in the United States and certainly North Carolina and the Triad. And we had a great conversation about having to facilitate a conversation about COVID-19 and coronavirus with your children, be they were younger children or older children. And we've fast forwarded a few weeks and wanted to touch base with her again and just wanted to welcome you, Dr. Nicolotti. Thanks for taking time out of your schedule to join us again.
Yeah, thanks for having me back.
So I think we're going to have a really good conversation today about, kind of what is, several people are telecommuting or virtually working or have had their schedule altered for work in some way. And the children around our state, of course, have had their schedule altered in a major way with doing virtual learning from their home or wherever they are with their guardian or their parent. So just wanted to talk through some of that today, and maybe you can help us and offer some words of wisdom and some tips and advice, Dr. Nicolotti, on just the best way to kind of navigate through this, what I've heard the new normal, quote unquote,
Mm-hmm.
So before I do that, I do want to just let people know we're going to be talking about specifically helping kids manage this changing landscape due to COVID-19. But for all the COVID-19 information that Wake Forest Baptist Health has, I want to encourage people, they can visit wakehealth.edu/coronavirus. That's wakehealth.edu/coronavirus. And that, of course, has much more comprehensive information about, symptoms, what to do if you're sick, visitor restrictions, clinic updates, all of that information. But all the COVID-19 related podcasts will also be on that page as well. So that's good. So Dr. Nicolotti, before I jump into the first question, if you wouldn't mind just talking with our listeners and telling them a little bit about yourself.
Sure, yeah. I'm a licensed child psychologist and the director of pediatric psychology and behavioral health in the Department of Pediatrics at Wake Forest Baptist Health.
Okay. So how long have you been with Brenner Children's Hospital and Wake Forest Baptist Health?
Yeah, so I've been working at Brenner and Wake Forest Baptist Health almost 6 years now.
Okay. That's cool.
Yeah, and I'm mainly with children and adolescents and families.
Okay. Well, we appreciate you being here and appreciate all the specialists and experts we have at Brenner Children's. That's definitely a huge asset that we have for this area. So a lot of this I can definitely personally relate to the last couple of weeks of adapting to this new normal and with kids being at home and trying to do schoolwork and maintain some sort of schedule. So the first question has to do with that, with a routine. Kids seemingly, they seem to work the best in a routine and structure. And we've had a lot of our routines just flipped upside down. So what should we expect from children, both young and older kids, with this situation of, us, we're trying to find our new normal, but they're trying to find their new normal too, aren't they?
Yeah, I think right now everybody is struggling to find the new normal for possibly the next several months. Kids' lives have been turned upside down pretty much. Suddenly, they're doing online school. Their activities have been canceled. It's recommended they don't see their friends in person right now. And they're pretty much homebound. And similarly, parents are dealing with the same scenario, many trying to work from home, trying to figure out how to be teachers from home and help their children with their schoolwork, keeping their family safe. So stress levels might be running high at home right now as families are getting adjusted to this new way of doing things, new way of life for now, and also maybe preparing for even greater movement restrictions. And parents may notice that some kids start having more behavioral issues, maybe, more irritability or moodiness or being withdrawn. Kids might be experiencing more of these negative emotions. And this may just mean that their kids are having a little bit of difficulty adjusting to the new normal. But comparatively, there's some other kids who may adjust pretty well to all these changes.
Gotcha. Well, speaking of adjusting, what are some, as they kind of work through this, kids, they share their emotions in different ways at different times. Just obviously, number one, at the developmental phase they're at based on their age. But number two, just, based on, their surroundings and their structure. So what's some advice, what's some tips you can share with us on how we can encourage children to share their feelings in constructive ways, where we can have, constructive dialogue and conversation with the children?
Yeah, last time when we talked, the question was more, should we be talking to our kids about coronavirus? At this point, it's not really that anymore. It's what should we be telling them? What conversation should we be having with them? So I think keeping lines of communication open with both younger and older kids is really important right now. There have been so many changes even in the last couple of weeks, and we're looking at even more changes down the road. I think parents can be aware of giving kids permission to talk about their feelings, asking them questions, letting them know it's okay to share their feelings and their experiences. There are some helpful questions I think parents can ask to get that conversation started. Things like, what worries do you have about coronavirus? How are you doing with all the changes? What is the hardest for you? Is there anything you actually like about the changes to your routine? Some kids might like sleeping in a little more.
Yeah.
What do you miss about socializing in person, going to school, or participating in activities? Yeah, so I know my kids are enjoying being able to sleep in a little more than when they actually have to go to school.
Yeah, indeed. That's a good point. One of my children, he had a video chat today actually with his classmates and his teachers. And it was the first time they've been able to do that, and it was great for them just to kind of touch base and see each other and talk in a group setting. So, we're all kind of learning as we go of how to adapt. So as kids are sharing their thoughts, their feelings, their emotions, what is the quote unquote right way for us adults to respond to the children? Because sometimes they might be sharing their feelings in what we perceive as a negative way, but they're still trying to figure out how to make sense of this. So, how can we respond as adults to what they're sharing with us?
That's a good question. Well, adults and parents can create an opening for children to be comfortable sharing and expressing feelings. It's important to listen to children, validate their feelings and experiences. Sometimes parents have to be a detective, especially with kids maybe who aren't as good at sharing feelings verbally. Some kids share their feelings more through behavior. And so, parents may have to notice that change in behavior and bring up with their children whether or not they may be feeling an increased level of stress. So acknowledging that adjusting to all of these changes can be difficult, I think is important for kids. And there might be an element of grief that children or teens are experiencing due to the loss of connection with their friends and family members, missing teachers and coaches, not being able to participate in their extracurricular activities, and really lost opportunities. I know many families that have had to cancel family vacations and birthday parties. Rite of passage experiences for older kids are getting canceled as well, such as prom, senior year activities have been canceled. College students are now home where they're used to having a lot of independence. So there's really a lot of adjustment that both older and younger children are experiencing. Parents can help by sharing their own challenges with the changes to routine and how they're managing these changes. They can let kids know that parents are adjusting too, and this can give kids permission to talk about these things. But parents should be mindful to do this in a helpful way in order to demonstrate it's okay to have and talk about feelings and to model helpful ways of handling this. Just be sure not to overburden kids with adult problems or instill feelings of guilt.
That's a good point. So let me follow up on that. Kind of based on we want to have these conversations with our children and have open and honest conversations, but what are there landmines we should stay clear of, or how much detail should we go into when the children start asking about the actual coronavirus, COVID-19, how sick people are getting? It's still just all over our media cycle and in the news, and their friends might be talking about it. So what's some guidance there?
For sure, yeah. I think it's in the news and media more than ever, really. I think parents can generally take their lead from kids. If a child or teen asks the question or asks for more information, then it's usually appropriate to answer the question and provide the information that they're asking for. Take into account the child's developmental level. I think that's important. Teens are likely to be more aware of the news. They're going to ask more informed questions and want more detailed information. The CDC has a lot of information out there, and they've developed a video that would be good for teenagers that can be found on YouTube about coronavirus. For younger kids, I think it's important to keep the information simple. There's a good book that I just came across for younger children that was recently put out by Dr. Christine Walsh-Forst called What is Coronavirus? That would be excellent for younger kids as young as preschool age to help them understand about coronavirus as well.
Okay. Interesting. Well, so I think one other point that I've seen float around a little bit on social media or a couple of articles is, and this is no secret, we've known this for a long time, children are very observant. They kind of pick up more than maybe sometimes we give them credit for. How do they feed off of their environment? What's going on around them, the way adults are acting, or what they're saying around the children. How can that affect them?
I think children are very aware of the stress level in their environment, and they're very likely to pick up on that. So even if parents are being careful, not to expose their kids, I think stress in general is heightened right now, and kids are probably picking up on some level of that. We're not only dealing with stress in our own home due to all the changes and health concerns, but there's also community and even global to the COVID-19 pandemic. Adults should be mindful of how their own conversations and behaviors might impact kids. Kids may be listening even if parents think they're having conversations behind closed doors or their kids aren't paying attention.
Mm-hmm.
And adults can also take steps to manage their own anxiety and stress, which will help reduce the overall stress level at home and provide a good role model for kids in managing their own stress and anxiety.
That's interesting. So, kind of talking about managing stress, what's some good advice or good ways that you've come across in working with patients and clients in the past that you can pass along to us about, there's different stressors that come in and out of our lives at different times. This pandemic stress to this level is I think new to a lot of us, but what's some good ways or advice you can share for helping us as families with kids manage stress?
Yeah, I think this is a really good time to brush up on stress management techniques. So, first of all, I think it's always good to engage in self-care. Take care of yourself by keeping a routine at home, making sure that you and your family are getting adequate exercise, spend time outdoors, especially now that the weather is nicer, get enough sleep, and eat a healthy diet. Also, families can spend time together by playing games, going for walks or bike rides, preparing meals together. Families can be creative. They can ask everyone to contribute ideas about how to best enjoy their time together. And I think another good tip is keeping things in perspective. All of our lives have been altered quite substantially, but keep in mind that this is a temporary situation.
Mm-hmm.
And another tip is focusing on things you and your loved ones can control instead of what's not in your control.
Mm-hmm.
That's always helpful. So the things that you can be doing are minimizing physical contact with other people, washing your hands appropriately, isolating yourself if you're sick,
Mm-hmm.
those kind of things. Another thing that's really important during this time is, physically distance from others, but don't socially distance or isolate. And so what I mean by that is stay connected with friends and loved ones, even if you have to do that virtually. Some people are getting together,
Mm-hmm.
staying 6 feet apart. So if you're able to do that, that's great too. And
Mm-hmm.
explore kids the best way to stay connected with others that they care about. Another way to manage stress is to practice gratitude by thinking about what you're thankful for, or you could have family discussions about that with your children. It's a great time to learn relaxation and stress management techniques, things like diaphragmatic breathing, mindfulness, meditation. There's lots of free apps for that.
Mm-hmm.
Or Calm, Headspace, Breathe Plus.
As this is, the next question can help me out and probably a lot of my friends who are also parents. What we're trying to do when we're trying to help them adjust to a new normal is help them stay focused. We still have these tasks or these duties with school or work. What's some advice that you've learned with working with kids and adolescents over the years to help them stay focused on being able to, in the midst of a weird new schedule, to still be able to focus on some of the items that they need to be getting done on a day-to-day basis?
Yeah, well, that is a challenging thing right now. I think everybody's in such a state of transition. It can make it harder to focus. I think one important thing to keep in mind is that parents can help to create a routine for children and the family at home. And this can be really beneficial to help kids focus. So you can have a set wake up time and bedtime, just as if your kids were actually going to school. Parents can keep a routine by keeping meal times consistent, and then make sure to schedule time for schoolwork, chores, exercise, relaxation, and family time as well. And parents can consider posting this schedule in a prominent place in the home so that everybody can see it. And this type of schedule can help kids adjust to their new normal for now. Older kids may enjoy helping to create their schedule and giving them a little choice in terms of when they're going to do certain things during the day. And of course, parents might have to check a number of times on kids to make sure that they're sticking to the schedule.
Yeah, that's good advice. I love the idea of having that schedule in a real prominent place and reminding the kids that they can try and stick to that as closely as possible. I think generally speaking, kids are pretty resilient and amazing little beings, and they're able to adapt to a lot and kind of work with lots of different situations. But for some children, they might have more trouble than others adjusting to this new normal, their life kind of being flipped upside down. They're not being able to connect with their friends like they used to, or go here or go there, or interact with other family members, maybe grandparents. If we notice, a child in our life maybe having a little bit more difficult time than we think, or more difficult than normal, what are just some ideas or some help that you can point us to for making sure that we're taking care of all children as best we can?
Mm-hmm. Yeah, that's an important question. I think especially kids that have had anxiety prior to this pandemic might be more vulnerable to being even more anxious during this time. But of course, anxiety is heightened for everybody.
Mm-hmm.
So if you notice anxiety in your child, or they're talking to you about it, take them seriously. Try not to minimize their feelings or symptoms that they're experiencing. And if you have a child or teen who's having any difficulty functioning day to day, if you're noticing that they seem more tired and withdrawn, if they can't control their worries or having trouble with sleep or appetite, these can all be signs that your child is having difficulty adjusting and might indicate that they would benefit from professional help, especially if it's ongoing. A lot of counselors now are offering virtual services by phone or video platforms that are easy to set up. Yeah, I mean, that's what I'm doing right now.
Mm-hmm.
A lot of insurance companies now are relaxing some of their guidelines and criteria, so they're paying for a lot of the video services, counseling services. And parents that are concerned can always talk to their pediatrician, their school counselor, their insurance company to get a list of people in network. And there's also state licensure boards, such as the North Carolina Psychology Board, where parents can get a list of licensed providers in their area. And then, of course, to help manage anxiety, limit news and media exposure, especially regarding the COVID-19. This kind of repeated exposure can create more anxiety for kids.
Mm-hmm. Interesting. Well, that was really good information. And we'll have, if people can also kind of check out those services and those providers available on Brenner Children's website or the wakehealth.edu website as well.
That's an excellent website and source of information that's always being updated.
Yeah, and I want to switch gears a little bit, Dr. Nicolotti, as we're talking with you about how to process through this new normal with our children, and just trying to maintain some semblance of structure and schedule. One word that I've heard more than once in my house is bored. dad on board, dad, if they're done with their e-learning or, they don't want to follow the chore time, creative time on the schedule. Context of social distancing, and we've heard more and more too about sheltering in place for a time. What's some advice or some words of wisdom you can give us about helping combat the boredom situation with the kiddos?
Mm-hmm. Yeah, boredom will probably creep in, especially as kids are spending more time at home than ever. Again, I think having a schedule can be helpful to fight boredom because it gives kids some structure.
Mm-hmm.
But beyond that, help them figure out a new project to work on. They can maybe build a fort in the backyard or make a birdhouse or plant a garden. My kids have decided to make a new cat stand in our house. Yeah. Also, they can take the opportunity of having more time at home to complete some home projects. Parents may appreciate this one. So maybe kids can clean out their rooms, identifying clothes that don't fit anymore, toys that aren't being used, and donate those to people in need.
Mm-hmm. Yeah.
Yeah, and then help kids figure out how they can continue to participate in all the activities that they enjoy that have been canceled. So, for example, if they were on a basketball team, they can practice basketball skills in the driveway. If they're involved in, theater or music, create a theater performance at home or a concert. Take virtual music lessons. So I think there's lots that kids can do to stay busy. I think it is important that kids and teens stay connected with their peers and their friends. A lot of them will be doing this through social media, which I think is important. Parents just may want to limit the use of social media.
Yeah. Well, speaking of still wanting to be connected, we might have a situation where we have a child or maybe a teenager who doesn't necessarily grasp or appreciate the social distancing recommendations and how serious they are, and they want to, still connect with their friends, go over if they're younger for a play date, or go hang out if they're older with some of their friends. How can we work through that situation if we're seeing that in our homes, with them wanting to not really be like, oh, the social distancing doesn't really apply to me because, I'm 15 and 16 years old. It's not a big deal. How can we respond to that?
Yeah, I think that's a fairly common response. So, first of all, parents can be a good example to their children in this regard by, not inviting people over and not, staying within 6 feet of neighbors and so on and so forth. But also help them understand the real reason and purpose and rationale for these recommendations and why at this time especially it's really important for us to adhere to them.
Mm-hmm.
And parents can help their kids problem solve about how they can stay socially connected but physically apart. And, for the very youngest of kids, they may have a difficult time understanding the rationale for some of these things. For example, why they can't hug their grandma. And this might be confusing. So, parents can work on explaining that to young kids in an age-appropriate way.
Yeah, that is helpful. I appreciate that. So, Dr. Nicolotti, as we wrap up, I just want to let people know that they can visit our website again. It's wakehealth.edu. There's information about children's services and if someone needs to contact a professional. Also, if people are just looking for COVID-19 updates, they can go to wakehealth.edu/coronavirus. And we have a plethora of information on that site, including this podcast and other COVID-19 related podcasts we've done. So, Dr. Nicolotti, I know you're busy. I appreciate you taking the time and chatting with us today. This has been so helpful. So I really appreciate it.
You're welcome. It was really nice talking with you again.
Thanks everyone for listening to this Best Health Podcast. And feel free to go to wakehealth.edu/podcasts and look at the full range of podcasts that we have. If you have additional time on your hands, you can listen to some of our other podcasts. And until we talk next time, I encourage everyone to please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.